was 3 years ago when I was 300 pounds. I didn't want to, some mornings I didn't want to get out of bed. I was that, feeling that bad about myself. But now I can't wait for morning to come, get up, put on my makeup, go to my closet, see which outfit I'm going to wear today, which outfit I'm going to look even better in. It's just awesome, absolutely. And I have to thank Dr. Brauman for everything he's done for me. He's changed my life. Oh yeah, very disappointed, because after putting in the whole hard work, after working out and being so good for 12 months, I had all this excess skin hanging everywhere on my body. Like my arms, my tummy, the tops of my legs, my bum, everywhere, even my back was all skin, and it was so, so disappointing. So it was. Even though I had lost 85 pounds, I felt as if I was 185 pounds heavier because I had all this excess skin. It was so disappointing, and I just thought, well, why did I bother? I had gone to a personal trainer, and she said to me, there's no other option. You've no other option but to have cosmetic surgery.
That is something that you almost do not realize it before you undergo what I would call massive weight loss. There are consequences, unfortunately, to the aesthetic and the way you look, and that is not easy.
Hi, Linda. Good morning.
Hi, Josie. How's things?
How are you? Have a
Great,
seat.
thank you.
All right.
I came from Cavan, travelled to Dublin Airport, and flew with Aer Lingus to New York. It was about 7.5 hours flight.
We'll go over the areas that he's going to be marking.
I'm actually having lipo done on my arms and on my legs to get my body in contrast with the tummy tuck that I had last year. And my arms are a big, big issue for me.
Dr. Brauman's going to come in. He's going to look at your chart, and he's going to look at your history and physical.
People had said to me, oh, what's wrong with your arms? And, that my whole night would be destroyed. I'd be like, oh, let me just get out of here. you'd be in tears. That's what I went and said. I really want to get my arms done.
Hello.
Good morning, Dr. Brauman.
How are you?
Good, thank you. The morning of the surgery, I come in, no problem, no nerves. It was just, I couldn't wait for the cameras to leave, to be honest. Just get me on the table. I want to see the results.
Okay.
Okay, yeah.
So we're all
set, ready
all
to go.
set? Okay.
Yes.
First of all, how are you feeling?
I'm feeling absolutely great. Absolutely wonderful.
That may be hard for people to believe. You've just had surgery.
Well, I feel great now because it's been nearly a week and a half since surgery, and I'm really recovering very, very well.
She was like this 2 days later. So she was fine. And most people are fine within a couple of days, and that is the beauty of it. If you do it in such a way that a person is fine within a very short period of time, that makes it easy for the patient, but more importantly, it is safe. It's the safety issue that we come in again and again.
Every morning when I get up to take my shower, I'm there standing in the mirror and twirling around, and every day I can see, that the swelling has gone down so much, and it's such a big, big improvement. Like, even my family can see it already.
And it's clear, and and that's the beauty of it. It's dramatic, and this is the thing that makes you keep it up, because now you're encouraged, because now it's no longer unfair, now it's fair. We all want to do everything ourselves, and we start making judgments about help and why. When you need help, you need help. That's all there is to it. And you try to get it, and somebody has to give it to you. And that's what happened with Linda. I mean, nobody says a word if you sprain your ankle and you use a cane. You need a little bit of help for a certain period of time, and that's all there is to it.
To begin with, then I had the tummy tuck, and then I had fat into the buttocks to take the dimples out of the buttocks. That was on the first procedure. And this last procedure, I had my forearms, I had my upper arms, my lower back, the tops of my legs, the backs of my legs, inner knees.
When did you decide to break up her surgeries into two separate components?
Oh, almost immediately. I essentially said to her, what bothers you the most? You know, in terms of your lifestyle, in terms of just what bothers you. And it boiled down to the fact that what bothered her the most was her abdomen. And that was what we tackled first, because it was clear that she needed a lot of surgery. She needed a lot of things done. And the question is, how do you deal with it? Mm-hmm. You do what is important to do first, and you take care of all these areas together so that when you're done, even with the first stage of the procedure, the person looks symmetrical, they look proportional. That's important because you don't want to leave someone after one surgery with something that looks very disproportional so that they absolutely have to have the second stage of surgery. Second stage of surgery is optional. If you want more, you can always have more, but you don't have to have it, and that's very important.
It's not just a matter of, you know, getting you in, you know, get your job done, pay your money, whatever, get out the door. It's not like that. It's, oh, I mean, it's just, you actually enjoy coming back down for the follow-ups and everything. You know, you really look forward to it because, you know, you're going to have a fun few hours here with the girls and with himself, Dr. Brauman. It really is. It really is. And the one thing about Dr. Brauman too was he explains everything before you know exactly what's going to happen to you, which that's why I don't think I was one bit nervous, because I knew exactly what he was going to do.
Do you think you'll have Dr. Brauman in your life?
Oh, forever. He's my hero.
Absolutely.
Absolutely, forever and ever. Not only is he my plastic surgeon, but I've made a friend for life. Definitely, definitely for life.
When you have a patient, and that's the nice thing about plastic surgery, and it turned out to be the nice thing, because I always thought that plastic surgery was one of those professions where you saw someone and you did what you did and that was it. But it's not so. You do create a relationship with people over the years, with them, with their family, and that is a positive. You know, it's very nice to be positively involved in someone's life. And yes, we called her to see how she was and to make sure that she was doing okay and that there were no questions and so on. We always do that.
To hear that you have changed someone's life and just made it better, that has to be great.
Makes my day. It really does. Makes my day every time. Because how much more reward can you have for your work if you get the reward almost instantaneously? Because the next day, the day after surgery, that's it. You know, they see the work, and that's the beauty of it. So if you're a surgeon, and surgeons are usually impatient, this is the ultimate reward.